is Kathleen Lisson. I'm a certified lymphedema therapist and board certified massage therapist practicing in Pacific Beach area of San Diego, California. And today I want to talk to people who have had liposuction surgery or a tummy tuck or a facelift, Brazilian butt lift that involved liposuction. I want to show you some of the tools that I use that will help you if you have lumps and bumps, anything unevenness beyond just swelling. So I do manual lymphatic drainage, which is a type of massage that helps to reduce swelling, but there's more to liposuction than just swelling. There are lumps and bumps and unevenness as the swelling subsides, and what we want to do is give you a beautiful stomach, beautiful legs, beautiful arms, not looking like you had surgery. So let me show you kind of the complete selection of things that I offer and show to my patients, so you kind of get the inside tour of the secrets that I share with my patients. So first, this is an abdominal board. So this is made of a hard cardboard. There's some foam in here. These are available on the internet. I also have several in my office, different sizes. This is crucial to wear if you have had liposuction on your abdomen. This absolutely gets the results that I want for my clients wearing this as much as you can per day for as long as you can. So this helps to keep the results that I give to my clients, helps them continue to heal in between sessions. So a lot of people know about abdominal boards, but not a lot of people know about Comprex or foam pieces. So this is from the lymphedema side of my world. I'm trained as a lymphedema therapist. Lymphedema is a side effect of cancer surgery, and it's a chronic illness, a chronic swelling. So we use, as lymphedema therapists, we use bandaging, we use compression garments to help control the swelling of our clients. So I took some of my information and knowledge from that side, a more medical side of controlling swelling, and have brought it to my clients. So this is something we use as lymphedema therapists, and I'll show there's several different sizes I have. There's several different shapes that I have. This is a larger version of this one. So this is made of foam, and it's shaped like a kidney, and I don't know if you can see, but it's also rounded on the front and it's flat on the bottom. So we use this, I use this in my practice if you have like a little patch of swelling that you want to go down, a little patch of where the tissue has become a little fibrotic, and we really want to control that. So I use these in different shapes, as well as the abdominal board, and then you should have been given a compression garment that you put over all of this. So between this and then there's foam sheets, I have foam padding, so I can make a rectangle or a square of foam. Those really help to personalize your treatment, because each client, the swelling shows up different on every body. It just is different with different doctors. It's different with different bodies at different ages. I primarily see people 40 and over after their surgery. So I know how to handle the swelling and how to get it go down, and it's an ongoing process. So you'll come into my office for 2 to 3 times a week. I do have people who work and live with their bodies. Like I have a swimsuit model, so she'll come in 5 times a week because she really needs a perfect result, because she makes her money with the display of her body. But if it's an average client, I'll have them in twice a week, and we'll use different techniques to reduce the swelling. So the first one, and the one that I learned at school for lymphedema therapy, is manual lymphatic drainage. So that helps use the body's lymphatic system to reduce the swelling. And I also use other techniques. So this is a time in a video where I want to talk about something that I've heard that people have told me if they get their surgery in Tijuana, if they get their surgery in Miami. There's wonderful surgeons there and wonderful post-surgery care throughout America and Mexico. But some things that I've heard is that people are scared when they come into the massage because they're convinced that it's going to hurt. And I believe massage can hurt if you don't have a wide variety of tools and you don't use those tools to help the body to relax and open up the tissues before you either move fluid or you try to break up some scar tissue. So what I do, I have hot stones. So this is one of my hot stones. I have a hot stone machine that I use. So I'll put the hot stones on the body and that will warm the tissue up. And then I'll use either cupping. This is a silicone cup, and then I have an electric cupping machine that I'll use, and then I also use these IASTM tools. So this is instrument assisted soft tissue mobilization. So I'll warm the skin up first, and then I'll use different tools, and each tool has a different purpose for moving fluid, or this tool is really great for, it has a little bit of a narrower edge here for breaking up some of the scar tissue. And then the lymphatic cupping, when I use the cup machine, I usually use it to move the fluid out and move the inflammation out after we do some of the deeper work to break up the scar tissue. Your body will have some inflammation as it is repairing itself after breaking up some of the scar tissue. So I'll use the cupping machine. It's over there, so that's why I'm looking at it. Or I'll pop on, even when I'm using the cupping machine, I'll pop on one of these old-fashioned manual silicone cups. And this really helps, I find, with sometimes the cannula scar will kind of go inside and have a little scar tissue around that. So this it uses negative pressure to push it pulls the tissue up. So instead of going down and pushing down so much, which can be very painful, we pull the tissue up, and that's how we get more space. That's how we break up the scar tissue. And then just this gentle, very precise pressure. I've had education in IASTM, how to use these tools, using them correctly. It shouldn't be that painful. They're used for a very short amount of time, and they just get big results. And then after I use those 2 or 3 modalities with the client here in the studio in the massage, then we go ahead and put the compression on, make sure they have the right compression garments, kind of troubleshoot them with how they're going to fit this into their busy lives, and get them the spot compression if they do need spot compression. And the goal is to get an even result, as natural as possible a result, and a result that the client is happy with. So if you have had liposuction, if you have a facelift or a tummy tuck, and would like to come and have manual lymphatic drainage, see if any of these other modalities would work for you in your instance. I don't use the IASTM tools after a facelift. We'll just use the manual lymphatic drainage. I might use some cupping for that taking care of post that surgery. So each individual surgery is different. I have experience in taking care of clients, getting them better after all the surgeries. Plastic surgeons in both America and in Tijuana refer their clients to me after the surgery, and I'd love to help you too. You can see me at solacesandiego.com. You can email me at solacesandiego@gmail.com, or you can call me at 619-880-6538. Thank you, and have a great day.